Evil. Nope, that's another YouTube channel. Sorry. With Seeking Light. That was another YouTube channel that I had conceptualized, put into place. Just started doing some stuff about the time when critical race theory was becoming a thing nationally. And anyway, didn't really go anywhere. I lost interest in it. There it sits. So anyway, this is Seeking Light. Formally, the Rehab and Documentation Guru. So we're continuing with the Biden mandate. The mandate through OSHA, which is known as the OSHA ETS, or Emergency Temporary Standards. And just the other day, there was a interview with one of the high-ups in government. I forget her name. Healthcare. Might have been Fauci's wife, which I'm blanking on her name right now. She's just not as famous as Fauci. But she was saying that they're looking for a permanent solution. So no longer is this going to be temporary, but they're going to propose a permanent solution to this. Of course, as I've pointed out, right now, the OSHA mandate is on hold by the Fifth Circuit Court of Appeals. And but it's important that I think we pay attention to what's going on here, because they will continue to push for this regardless. So there'll be back and forth in the court. It'll eventually make the Supreme Court. Who knows? But we're reading the FAQ, the frequently asked questions of the OSHA ETS. And this is under question number 3, sub-question I. And this is the question. If an employee has previously had COVID-19, but has not been vaccinated, can they be classified as fully vaccinated under the policy, assuming they have antibodies? Are there any exceptions in the standard for employees who have natural immunity through previous COVID-19 infection? And then the answer, according to OSHA: no. The ETS does not offer any exemptions to vaccination requirements based on natural immunity or the presence of antibodies from a previous infection. Fully vaccinated means a person's status 2 weeks after completing primary vaccination with a COVID-19 vaccine with, if applicable, at least the minimum recommended interval between doses in accordance with the approval, authorization, and listing. That is, 1, approved or authorized for emergency use by the FDA, 2, listed for emergency use by the World Health Organization, or 3, administered as part of a clinical trial at a U.S. site, if the recipient is documented to have primary vaccination with the active, not placebo, COVID-19 vaccine candidate, for which the vaccine efficacy has been independently confirmed through data collection, whatever, or if the clinical trial, yada, yada. Okay, so anyway, long, drawn-out sentence. So I have a problem with that last point there. So basically, if you're part of a clinical trial for a new drug, a new vaccine, let's say, and you want to say, hey, I'm in this clinical trial, therefore I should meet the mandate, haven't had the other vaccines, but I'm part of this clinical trial, and they find out that, okay, you're part of the clinical trial, they verify with the people doing the clinical trial that you have had the placebo, and then therefore you're not exempt from this mandate, you suddenly discover, oh, I'm part of the placebo group. Doesn't that skew the results of the clinical trial? Does it no longer become double blind? Yes, the answer would be. First of all, I just want to go back to this whole natural immunity thing. So for those YouTube bots that are watching me, this is fully confirmed. Here we go. Where's the article? This is from Science Magazine, science.org, from their health section. This was published back in August 26th of this year. And this is based on the Israeli study, so this is confirmable. It says, having SARS-CoV-2, which is the disease caused by COVID-19, having it once confers much greater immunity than a vaccine. So YouTube, if you have a problem with me saying that, you have a problem with Science Magazine. And I'm going to guess that none of you bots that work for YouTube work for Science Magazine or have a science background specifically. I'm going to guess. So anyway, but here's the remainder of the subtitle. But vaccination remains vital. So the rest of your title, Science Magazine, so now I'm taking exception with Science Magazine. The rest says you have better protection with natural immunity, but take the vaccine, which has less protection. Now, they'll probably say, well, you get a combined protection. But we're talking about minuscule evidence-based improvement or enhancement in protection. Minuscule. Like beyond statistical significance if you get vaccinated with natural immunity. And how do I know that? I've read the article. Anyway, let's continue. So going back to what they say about this, you need the vaccine too. Let me see. An employee who does not meet this definition is not considered fully vaccinated. Well, of course not, because one, you're not getting the shots. But two, let's not call these shots vaccines. They are a form of inoculation. They're just not as effective as natural immunity, as proven by that study, as quoted or stated by Science Magazine. Let's continue. Regardless if they had previously tested positive for COVID-19. Therefore, that employee must be treated as unvaccinated and either receive a vaccination or undergo weekly COVID-19 testing and wear a face covering in the workplace. All right, so that is the ETS response to what's natural immunity confer. And according to them, nothing. So that's helpful. And it's unscientific. And it's problematic. Anyway, I'm going to continue doing these readings. I hope they're helpful to you. This document's available through OSHA.gov. And at some point, it will probably go into steps of being put into effect and continue to be challenged and have stays. And then they'll keep pushing it as long as we have Biden in the administration, which who knows how long that'll be. But if Kamala Harris is in the presidency, it's still going to go into effect. 2024 can't come soon enough. This is John Adamson with Seeking Light.